Hi, welcome to Body Language, the show that listens to your body, and we want to know what your body is saying to you. My name is Edgar Champagne. We are glad to have you join us in the month of December at CTV Beam. Going to be talking today with a personal friend of mine, Dr. Michael Malone, and he is with the Malone Clinic. He's working with his father. Dr. Malone, welcome to the show.
Thank you. Thank you for having me.
Now, I appreciate you coming over. For some people who are in Alabama, we're in Alabama, and we know that you're in Georgia. Give us a profile about, how you came up, where you studied, and how long you've been in business, sir.
Sure. So I got to Columbus as far as working in 2005, but I was born and raised all over the place. My dad was in the military.
Yeah.
So as many of people in our community, we came here through the military. We arrived in Columbus in 1977. Mm-hmm. I trained, I went to school at Pacelli. St. Anne's Pacelli, now it's St. Anne's Pacelli. After that, I went to Howard University, and then I went to Meharry Medical College in Nashville, Tennessee. And after going to Nashville, I trained at Wayne State for my residency, and then I came to Columbus. So I actually arrived in Columbus in 2005.
Yeah. Two of my favorite cities, Nashville and Detroit.
Yes.
Yeah.
So it's taken me all around.
Good job. What was it like being a military brat?
It was great in terms of the stories, the diversity.
Yeah.
Your dad would always talk about different things that he was going on. We lived in Germany, so I had a chance to live overseas growing up. But I got here in about third grade, but we lived on base for the first year, and so you got a chance to meet a lot of people. And over the period of time, one thing about the military experience, and when I was in medical school, I got to train at a military base at Fort Campbell in Clarksville, Tennessee. It didn't matter if you were in a room with the general's wife or a private's wife, everyone wanted quality care. And so one of the things that I appreciate even in this community is that people just want quality care. Mm-hmm. Doesn't matter who's in the room, what the situation is, whether you have insurance, don't have insurance, that kind of thing. And that's one thing I'm really pleased about.
You and your father have a magnificent, pristine record in Columbus, Georgia, in Chattahoochee Valley. So we've never heard any kind of negative press about you all. What was it like growing up with your father as a military person?
It was amazing.
Did you have any pressure to become a doctor like him?
I didn't. I didn't feel the pressure. A lot of people have asked me that question. It's one of those things where, when I was about 5 years old, my dad was always going out of the house. One thing about obstetrics is that, babies come at all hours of the night. You can't, it's not a 9 to 5 type of job. And when he would leave a lot, as I got older, I just kind of wanted to follow him. Mm-hmm. And he would allow that. But early on, when you're young, 5, 6 years old, you can't really see a whole lot. So he'd put me in the waiting room. And so you can imagine a child in the waiting room, as when I talk to young people about this all the time, I'm like, how many people are in the waiting room? The whole room lights up, And so when I'm in the waiting room, we would play a game of whether or not he delivered a boy or a girl. And unbeknownst to me at the time, because we would have this game of, Dad, I'm choosing a boy today, I'm choosing a girl today, I seem to always win. Ooh. Now, I didn't realize this until, many, many years later that, a lot of times when we deliver a baby, we're so caught up in the moment, we hand the baby off to the pediatrician or those in the room. You may actually forget what you just did because you're going from room to room.
Yeah.
And so when he'd come back in the room, I know now that he was allowing me to win, so I'd come back and say, I beat Dad today. But, that's just a small story. But as I got older, I got a chance to see more and do more. And the pressure really wasn't there to be like him, but it was just, I was around it. I was listening to the verbiage.
Yeah.
I'd hear him talk and triage patients over the telephone, talk to nurses. And that was exciting to me. And so as I got older, I wanted to see more. And then, Edgar, there was one day when I was a senior in high school, and I was with my dad about 1 or 2 in the morning, and one of the techs had called out. And I was I'd watched my dad do thousands of cases, but there was one particular night where my dad said, you know what, everyone is sick, and we need a hand. Do you mind helping me out? And I was like, Dad, sure, I'd be love to. Mm-hmm. So he scrubs in, and he goes in the room, and he kind of looks back at me, and he goes, okay, sons, go ahead and scrub in. I turn the sink on, and 2-3 drops come on. I'm like, I'm ready to go. And he turns around, he was like, "What are you doing?" His whole demeanor changed, right?
Yeah.
And I said, "Dad, I'm ready. I'm about to join you." With 2-3 drops of water on my hand, no soap, nothing.
Wow.
I'm that excited. He said, "You have been watching me thousands of times do this, but you have not been noticing the little nuances. Get back at that sink and don't come back in. Don't come in this room until I tell you to." So I'm scrubbing. Now I'm nervous. I'm scrubbing. Ready, Dad? Stay out there, like that. So, and then I finally come in. Of course, people were watching to see that I was doing everything right. So I come in the room and I'm sweating bullets before I even got going. But this is what I wanted to do. And so when I got on the other side of him and I'm retracting and doing everything I wanted to do, I probably, had moments in there where I was just like, out of body experience, so to speak. But it was one of those things where I didn't have an opportunity again to operate with my dad until I had gotten through medical school and residency.
That was a pretty good little distance.
So that was one day out of a life in that high school experience.
Yeah.
But I prayed all the way through that I'd have just one more day to be able to be on the other side of them. So I know it sounds, sappy, but it's one of those things where you don't know where life's going to take you.
That's correct.
And so you're going through school, and you become this professional student. It takes you all this time to get there. And it's been 14 years.
Wow.
That we've been working
Dr.
together.
Michael Malone, my special guest. Now, where are you located? And give the email address and all your different social media.
Yes, sir. So we have 3 locations. We are across the street from Piedmont Hospital at 2039 10th Avenue. My dad's been in that location since the middle 80s. He initially started at 13th and 13th in 78. So we're located there. We have an office in Phoenix City at 1610 Opelika Road. And we've been there for about 15 years. And we recently, last year, opened an office in Eufaula, Alabama. It's on Broad Street, and it's 610 Broad Street. And there's a surgeon by the name of Dr. O'Neill Culver, and he's been gracious to allow us to use some of his office space, and we've been down there almost 2 years.
Good.
And that's been a really cool experience. Rural medicine has been something we've been talking about for a long time, and we actually started doing it last year.
Well, that drive to Eufaula is nice. I used to go there and do discos and everything back in the day.
Okay.
All right, so now obviously, me being a man, I don't know anything about your particular line of work, but I have women that have got on Facebook and emailed me questions. So
Sure.
We're going to take the first question from Karen. Okay. Dr. Malone, is it safe to exercise when I'm pregnant? And I got another part to that question, but is it safe to exercise when I'm pregnant?
Absolutely. Exercise is very important. Wellness is very important. You can only imagine, if mama's not happy, baby's not happy. So if you're a person who likes to exercise, we encourage it. There are obviously certain strenuous exercises that we would want you to abstain from in terms of like heavy lifting greater than 15 pounds, but walking, treadmill, absolutely.
Part B is when should you cut it off? At what point during the pregnancy, and how much or how long do you do it per day if you did it per day?
Right. So for the most part, most people exercise somewhere between 30 minutes to 45 minutes a day when they're in the exercise mode. Now, this is the thing. When you're exercising, you want to make sure that it's something that's common to you. You don't want to initiate exercise just because you're pregnant, okay? Because then you got to focus on what it is you do best. Cardio is important because you're talking about yourself and the baby, and staying hydrated is very important. So my personal belief is if you're happy doing it, it's going to be happy for the baby. It's one of those things where there's not like a do and don't sort of situation. We have swimmers, we have runners, we have walkers, and I think if you got to use common sense in these sort of things, but as far as length, there's a thing I'm going to tell you, Edgar, in pregnancy. Mamas start out real excited about the pregnancy. Their smile is this big, okay? But I have this thing about the smile going like this as the baby gets bigger. Now, As we get around the patient, we're like, oh, you're beautiful, you look great, your cheeks, you're amazing. Our smiles get bigger. Their smile's like, I want this baby out. I don't want you telling me anything else, you know, that kind of thing. And so exercise is the same thing. You know, I'm sure as mom gains her weight and the baby gets larger, that, you know, she'll probably curtail some of that exercise activity. But I do think doing something every day is important.
Very good. We're talking with Dr. Malone from the Malone OBGYN clinic here in Phoenix City, Columbus, 2 locations, and Eufaula. So we'll be right back. I got questions from Danielle and Faith coming up next, Doctor.
Great.
Okay?
Thank you.
Stay with us. You're on CTV Beam with Body Language with Edgar Champagne. Don't go away.
So they say it's a man's world? Well, I don't see anybody's name on it. While they were out doing their thing, we slowly changed all that. We changed all that. Today, women can do anything men can do. And there's one thing we're even better at.
Hey, welcome back to Body Language, the show that listens to your body. What is your body telling you? Is it aching on your knees, your back bothering you, maybe a headache or something? Today we're talking with Dr. Michael Malone. He's an OBGYN doctor over in, I understand that they've got 3 locations now. I didn't know this, Doc. You got one in Eufaula.
Yes, sir.
But I know that they had one in Phoenix City and Columbus, Georgia. So Doc, getting back to the questions from our female viewers
Sure.
and everything, Danielle wants to know, when is a good time to first bring your teenage daughter in to see the doctor? Because there's so many interruptions out there with social media and different things like that.
Absolutely.
When's a good time to actually start coming and seeing you guys?
Well, that's a very good question. I appreciate the question from Danielle. The first appointment that you go to in OBGYN, you can imagine at a young age, can be a very harrowing experience, okay? But I encourage, because a lot of times you're going to a pediatrician early on. It's recommended that you come to an OBGYN around 13 to 15. And that first appointment is not necessarily a full body exam. It's just a kind of a meet and greet. Our children right now are under big time siege, right? Social media, all sorts of things. So as much as we protect our kids in the home and in the family, as soon as they leave the home, a lot of the protections leave them. And so as a part of a person in the village, and I'm one of those people in the village, because as much as I am an OBGYN, I'm still another one of those people in the village, and I probably learned a lot of this from my dad and listening to all his talks, that we have an obligation to empower our children and to protect them, right? And so the levels of protections and the layers of protection now are even more so needed. And Edgar, I know you're a veteran. A lot of times when I talk to my veteran fathers, I say, you know, what is it that you want more? Bigger guns, bigger bullets? They said, no, Doc. What we want is better body armor. Mm-hmm. Because when we get off the plane or whatever that is to get to the military base, we know that obstacles lie in the mist. And we know just as much as a clean sweeper can come through and clean everything out, as soon as we come through, there may be an explosion. We know it's coming. We just want to know, can we survive the blast?
Sure.
And I kind of use that mantra in what I'm talking to with my younger patients to say, look, we know things are going to hit you. As soon as you leave this house, we know when you're going to the locker room, or when you're going to get your books, when you're going to the Target, the Walmart, there are people, there are predators everywhere. But I got to give you enough body armor. Mm-hmm. So I have to give you my own layer. Mom and dad have given you a layer. Grandparents have given you a layer. Pastor has given you a layer. I too have to give you a layer of Kevlar, something that possibly you will survive the blast. Because if we play the game of it's not going to happen to me, my child is not like that.
Too good, yeah.
You know, it's one of those things. So I encourage an early appointment, just a meet and greet. Hi, how are you doing? This is what we do. And then as you get older, certainly that first exam. In our training, it tells us now that the pendulum is always swinging, that the first exam is at 21. But in our community where, you know, activity can occur a little earlier, you know, we encourage you to get in earlier.
Danielle, I didn't hear you mention pap smear in this party. When is it?
Sure. So the first pap smear is actually, it's not recommended until you're 21.
Oh.
Now, that's recent study. But again, in our community, we've seen abnormal cancerous cells early on, before 21. The whole pendulum is swung to 21 because there's been a lot of unnecessary examinations and tests that have been done on younger patients, and the theory is if you have an abnormal pap smear, you may do something that may change the cervix and increase your risk for preterm labor later on in life. And I know that's kind of heavy for our discussion here, but the crux of the matter is, if you come see us, we're going to do a pap smear. Okay, and that pap smear is going to help determine whether or not you have abnormal cervical cells. And the theory is start at 21, but if you're sexually active, we're going to encourage that you get that pap smear done a little bit sooner.
Dr. Michael Malone is my special guest on Body Language. Doc, let me ask you this question. Now, this comes from Faith. Since we're in the winter season, what medications can I take for a cold during pregnancy?
Sure. So there's a lot of things have changed recently. And when you go to your over-the-counter drugstore, Tylenol cold and sinus is what we always initially start with, because typically the cold is a virus, and you really can't treat a virus. You're just basically treating the symptoms of that virus. So you're going to get Tylenol cold and sinus. That's going to be perfectly safe in the pregnancy. If you're congested, Sudafed is very effective. Outside of that, Robitussin for cough is important. Now, just like we talked about before, common sense is not common to everyone. If these modalities are not working, then we certainly encourage you to be evaluated for things like the flu, which could be very detrimental to you and the baby. And that can be done with an easy swab. Outside of that, staying hydrated.
Can they take a flu shot while pregnant?
Absolutely. It's highly encouraged. If you go back in history and look at the last pandemic, it was with pregnant women early on in this century, but it's one of those things where the flu shot is highly encouraged.
Or I got a question now, Doc. Dr. Malone is my special guest right now on Body Language. This is from an older person, apparently Diane. Not because of the name, but the question when you hear it. It says, I've gone through menopause, but I'm experiencing spotting and staining. What should I do? Right.
So after a woman experiences menopause, it's highly unlikely that she'll spot. Okay. If she does, it's very concerning. Okay. And it could be concerning on two levels. One, it could be absolutely nothing. It could be what we call atropic vaginitis, and it's something that we can easily treat. But on the other hand, spotting when you have already gone through your menstrual cycle could be abnormal endocervical cells, which could cause endometrial cancer. Again, treatable, and it's something that needs to be evaluated. So if Diane, you're experiencing those symptoms, as you say, we encourage you to get in and get evaluated as soon as possible, because it's something that could be easily treatable.
Okay. Just before we take a break, we're talking with Dr. Michael Malone. Tell everybody again the locations of your 3 offices.
Sure. So in Columbus, we're at 2039 10th Avenue. It's right across the street from Piedmont Hospital. Now Piedmont, you know, when you and I growing up, it was the medical center, Piedmont Hospital. Here in Phoenix City, we're at 1610 Opelika Road.
What's a landmark in Phoenix City? Close to it.
We're right, it's a service road, so we're right behind the Applebee's. Okay. So the Applebee's is on 80. If you were to take the service road right behind it, that's Opelika Road. And I could also tell you the Smoky Pig, if you make a left at the Smoky Pig. But So that's where you'll find us in Phoenix City. And then in Opelika, we're on Broad Street, right down Broad Street. It's right next to the...
Opelika or Eufaula?
I mean, I'm sorry, in Eufaula.
Okay.
On 610 Broad Street in Eufaula. And we're right next to the post office.
Oh.
And so there's the main post office there. There's a big bass. They call Eufaula the bass capital of the world. And there's a statue there. If you go past the big bass, on your left is the post office, and across the street is our office.
And your surgeon friend that let you all use the office?
Yes, his name is O'Neill Culver. Okay. So a lot of people know Dr. Culver because he's been there since the 80s providing amazing care. And he saw the need and the opportunity, and he had been talking to myself and my father for years, trying to encourage us to come down there, and it's been a tremendously rewarding experience.
Yeah. You remember in the first segment you were talking about when the smile is really, really, really big.
Yes.
And as it progresses, they get smaller, and then you all get larger.
Yes.
I want to talk to you about that smile because
Sure.
I saw an interview with Stephanie Mills. I want to ask you a question about that, okay?
Sure, absolutely.
All right, my special guest right now, Dr. Michael Malone, a personal friend of mine. You're on Body Language. We'll be right back on CTV Beam. Don't go away.
Families come in all sizes and shapes. Sometimes your friends are your family by choice, or sometimes you're just stuck with Uncle Charles. But what we know is that you want to protect the people that are close to you. But the flu can unravel everything. Your flu vaccine protects you and your family. No matter what draws your family together, protect yourself, protect your family. Everyone needs a flu vaccine.
Marie, you have prediabetes.
Prediabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom.
Yeah.
This is great news. Busy moms never get prediabetes.
Wait, what?
Let me just... Yeah, this is all the people at risk for prediabetes, and way over here, busy moms. No?
Welcome back to Body Language. I'm Edgar Champagne, and we are the show that listens to your body to ask you, what is it telling you? Your body's telling you something. My special guest today is Dr. Michael Malone, personal friend of mine. Dr. Malone, before we went to the break, I was about to set you up with this question. Stephanie Mills did an interview with another radio host. You know, I'm in radio, so
Yes.
I pay attention to what other guys are doing. And she had been married 3 times. She's 45 years old. She wanted a baby real, real bad. And we were talking about that smile.
Sure.
So she was happy to get impregnated.
Right.
And yet, during the course of the pregnancy, they determined that the child was going to be a special needs child.
Yes.
And she said, I want my baby. She went on, and the kid now is he's a senior in high school, homeschool obviously,
Okay.
but he's written a children's book and everything else. But now that smile from Stephanie kind of had to draw in real quick. On your job, how are you able to help a woman still be happy, healthy, terrific, and positive about if they got some bad news about something like that?
Sure. So one of the things that I love about the profession that I'm in, number one is we work through him. And I'm not a pastor, but I do witness life from the very, very beginnings of when we can technologically see it. And I believe that life begins in conception, with that ultrasound, all the way through to when I get a chance to deliver your baby. In the middle of that, I'm just watching his work, right? And so we're just an instrument of all the training and all the experiences that I've witnessed through my father and myself to get to the point where I go into a room and I tell a patient, this is what's best for you. This is what's best for your baby. But there's a delicate balance between baby and mom. And what do I mean by that? I mean that there's not going to be a mom that never wants an ultrasound to be able to look at their baby. If I say, hey, would you like to see an ultrasound? Yes, immediately, right? And that's what you would expect, right?
Sure,
You'd want,
sure.
Right? There's not going to be a mom saying, oh, not today, I'll catch you later, doc. Everyone wants to see their baby. So when you have that kind of mentality, and moms risk their lives bringing life into the world. In this region, in the region that we're in, it's one of the highest infant mortality and mother mortality rates, okay? And a lot of it is preventable, right? When I go to Eufaula and I see a mom coming in there with blood pressure of 200 over 120, and it might be her 7th baby, but she's so worried that if she goes to the ER, they're just going to send her home. Now, technically, an ER is not going to do that for that particular, but her mindset is, they're not going to give me care. They don't care because they're looking at me as my 7th child and that kind of thing. We've got to get away from that. In Stephanie Mills' case, she's 45 trying to have a baby. Kudos to her. But I'm sure we have a lot of tests that can determine whether or not you might have a genetic abnormality early on. And I do give that sort of expertise, I do give that sort of information to a patient early on, as early as I can, whether it be an ultrasound, whether it be a blood test. There's some amazing genetic tests that we can do now that will determine whether or not you have certain things. But then there's certain things we just don't know, right? You don't know until maybe the baby's delivered that you have to explain or as best you can. But the way technology works now, you know, we can identify a lot of issues that may be occurring with the mom early on. And then, look, in the state of Alabama or in Georgia, if you have an issue that needs another level of expertise, we have maternal fetal medicine experts here in the community that are amazing. And if they can't solve the problem, we send you up to what I call the Taj Mahal, which is University of Alabama, Birmingham. These individuals from UAB will send down an ambulance. They will send down a helicopter. And in rare cases, they've sent a jet down to pick up a mom. Now, that just shows you the level of resources that we have at our disposal. But if you don't go to the doctor, you would never know it, right? And so we can fly these patients out anywhere for issues. So if I identify an issue early on, you know, we'll have a step-by-step approach to have, you know, to help you get the best outcome you possibly can. And if you know early on, Edgar, you can make decisions. The decisions that are hardest to make, I would imagine, in all of this is how are you going to raise that child?
Right. I just got time for one more question on this segment, but you're going to come back next week. Here's the last question, Dr. Malone. What do I do if I miss 2 days of my birth control pills? This is from Sharon.
Right. And so Sharon, that's an excellent question because that's a question that I get often asked. If you miss one pill in your pill set, you can take 2. If you take 2 pills, okay, now that's missing 1 day, now you're doubling up the next day. If you've missed 2 days, you can catch up by taking 2 pills one day and then 2 pills the next. After that, you have to start a new pill pack. So if you can imagine a person who's on a tightrope that has a safety net, that birth control is that safety net. After 2 pills missed and another 2 pills missed, you got to look at it this way. Now you're flying with no safety net. There's no control. Birth control is your opportunity to control whether or not you get pregnant or not. Nothing is 100%, but birth control pills are at 99.8%. And so if you start missing pills, I would look at, and it's become a regular thing for you, I would look at a different modality for birth control. Doesn't mean that there's not something out there for you, but it tells me that we need to do something else that will be tailored to you. They'll give you a comprehensive approach to give you birth control. My special guest today has been Dr. Michael Malone with his father's clinic. They've got 3 locations, Eufaula, Phoenix City, and Columbus, Georgia. The Malone OBGYN clinic. The one that I'm familiar with is over by Piedmont. Thank you very much for looking at and viewing body language. It's Edgar Champagne. Dr. Malone, thank you. We'll get you back next week for another show, okay? Thank you, sir. Good to see you.
Thank you for coming in.
Absolutely.
That's going to do it for us this week. Don't go away. More on CTV Beam.